we have arranged in preparation for the Colombo Conference 2021. I see a lot of enthusiasm towards this topic, so I greatly appreciate that. And I see some of you are still in the waiting room. I hope that you will be able to be admitted before our speaker starts the talk proper. But before that, let me introduce the speaker. And before introducing, as you all know, this is part of the Colombo Conference 2021. We'll be having a webinar every month, and this is the second of this series of webinars. We had a very successful webinar last month, and this month it will be you are now attending this webinar, and similarly there will be other webinars in the months to come. And please visit our website. There will be more on the dates of the Colombo Conference. Due to the changing scenario, sometimes there may be slight changes, but the conference itself will be running as planned. So that's about the Colombo Conference. And let me warmly welcome you, all of you, to this webinar, the second of the webinar series. And it's my pleasant duty to introduce to you the speaker today. Our speaker today is R.D. Fidiatini. She's a medical doctor, graduated from Faculty of Medicine, Universitas Indonesia in 2002. She completed her doctoral program in Melbourne Medical School, Faculty of Medicine, Dentistry and Health Sciences, the University of Melbourne in 2012. The highlight of her thesis on how clinical reasoning is taught and learned in Australia and Indonesia motivates her to learn from how best practices in medical education can be implemented contextually. She is currently the head of Department of Medical Education, the head of Medical Education Unit, and the coordinator of Medical Education Cluster at Indonesia Medical Education and Research Institute, which is called IMERI, at Faculty of Medicine, University of Indonesia. She has been teaching in undergraduate and postgraduate programs in medical education and mentoring students and graduates in conducting research in medical education. With her team, she has been very active in conducting workshops for the faculty development in undergraduate and postgraduate medical education in her faculty and in other institutions in Indonesia and of course elsewhere for the past 12 years. She is a nominated panel member of the Aspire Excellence in Faculty Development since 2015. She authored and co-authored several international publications in peer-reviewed journals and conferences. She has also been involved as the reviewer of national and international medical education journals. Her research area of interest includes clinical reasoning and clinical teaching, interprofessional education, faculty development, curriculum development, and socio-cultural factors underpinning approaches in medical and health professions education. Now that is the official introduction to you about Professor R.D. Fidiatini. But apart from that, she is a very close friend of ours. She is a very active member of the Asia Pacific Network for Medical Education, and she has organized and even entertained us in many conferences and writing retreats of APMINET. And also she has visited Sri Lanka for a past Colombo conference, but unfortunately this time I don't think any of us will be able to meet face to face, but I'm sure she will be an online participant this time also, as well as an online resource person. So without much ado, I'm sure this is going to be a very, very interactive and a highly informative session. She wants to interact with you. So please keep your laptops and even smartphones connected. She wants you to respond to her questions and do some activities with you. So that all that will be waiting. So I will not keep you waiting for all that. So I will give the floor to Adi to start her presentation. Over to you, Adi.
Thank you very much for a very nice introduction, Gominda. And I really wish I could visit Colombo again and share with you and discuss with you and the colleagues in Sri Lanka on this topic. I do understand that this topic might be quite sophisticated to discuss, but we try to interact, of course, and try to highlight what's the importance of the topic to each of us. I know that some of you are health professionals, medical doctors, nurses, or other health professionals, medical teachers, health professions education teachers, or even medical and health professions education students. So let me share my slide and we will start our discussion. So whenever I was asked by the committee to be the resource person of this webinar as the pre-meetings for Colombo conference this year, I confidently choose this topic because it was asked by the committee, of course, and it also has been our research focus in our Medical Education Center in Indonesia, Medical Education Center and Research Institute in Faculty of Medicine, Universitas Indonesia for the past 2 years. So it's been we do understand that all of us, especially us now in Indonesia, we've been hit by a very, very catastrophic second wave of COVID-19 pandemic. And we just finished our discussion with the students launching their thoughts on how the students, medical students and also health professional education students contribute in this pandemic, because it's been very chaotic and our country needs us. So based on that, I think that our discussions on professional identity formations for medical teachers and medical students, and beyond that, for health professionals, health professions education teachers and health professions students is very timely. And I hope that at the end of the discussion, we can bring some lessons learned home on why the realization and the awareness around this topic, professional identity formation, do matter to us, especially in how it can actually guard us and make us be more adaptive in this disruptive era. So the outline of my presentation would be exploring what is it? What is professional identity formation? Sounds a very complex concept. However, without our realization in our day-to-day basis, actually, we've been forming, we've been constructing our identity professionally over time. And we will see some evidence, and probably I will try to share the key points of the theories around professional identity formation in relation to medical and health professionals and medical and health professions education, and the impact of that understanding towards ourselves, to us as practitioners, to us as educators, or to us as students. So I will try to ask you this and invite you to join me in sharing your thoughts. When you hear about professional identity formation, what comes into mind? Please access this Mentimeter by click the www.menti.com and use the code 2664089. I will just type that down in the chat room so that you can click that. Hopefully you can join that and write down what you think about professional identity formation, what comes into mind. Students to physicians, thank you so much. Role modeling, thank you. Okay, it's been great responses, thank you. I would wait for another 1 minute probably, so that to assure that most of you, or probably some of you, access to this. Thank you. Okay, self-awareness. Thank you so much. Okay, we are going to move on with this. To those of you who would like to still contribute what you think about this, I think we have got 3 key words of the professional identity formation. Thank you very much to those of you who have shared your thoughts. Socialization, wow, yeah. So all of this we're going to discuss in these presentations. And I think most of you also agree with the journey of the students to physicians, the importance of self-awareness as well as socialization, in which later on role modeling will come into part, and also the recognition of the roles, current roles, future roles. Yeah, thank you very much. Okay, responsibility, exactly. Okay, thank you. And I will move on to the next slide. So before we move on to the professional identity, I would like to remind us about the importance of personal identity. Of course, each one of us has our own identity, both personally and professionally. And it highlights that the identity formation is discourses. And it is actually how we try to develop our personal identity and how we take meanings from our surroundings. And it may consist of our individual identity, our characteristics, our personality, our likes and dislikes, how we see ourselves personally, the relational identity, how we connect our identity to our family, our networks, our cliques, and also the collective identity. So I would like to highlight this. Some of you has mentioned about the importance of the journey from the students to physician. This is a very interesting theory adapted from the developmental theory in psychology presented by Keegan, which then adapted further in medicine. And we can see here that when you see the identity formation in medicine, and I believe that it's also applied for other health professionals' educations, we see that there are 3 critical stages from the imperial, interpersonal to institutional stages. If we would like to highlight it the more, within the personal characteristics and the manifestations in the professional context, we can see that from the imperial, interpersonal, and institutional stages, in the earlier stage, the students, medical students, health profession students, their individual identity, their personal identity dominates. And their self-reflections is not necessarily high, sometimes it's very low, and their emotions can overwhelm reason. So they may assume their professional roles, but they are motivated by the rules or their surroundings, the regulations around them, for example. And moving on to the stage 3 and 4, where the self-reflections capacity increases, the students becomes more aware of what they become and who they are and how they take meanings of the triggers around them, the role modeling, their clinical experience, their learning experience, etc., so that they are not able only to differentiate what is black, what is white, but also what's in between, and have the reasons and resolve their dilemma. So that's what we picture ourselves as professionals. We don't only decide things or matters black and white, but we are also expected to decide things, to develop sometimes very difficult decisions in very difficult situations. So the more expert we are, the more we are expected to have such capacity. So we hope our students also moves on the right path towards that. And again, this scheme shows us that all of those processes are very dynamic, coming from the personal identity and the interactions with the environment, the social environment, the cultural environment, the professional environment, so that personal identity is formed. And then with the interactions with the professionals, with how the students see themselves in the future, will form their social identity and their professional identity. So this is a very fun way to check whether we've been aware of our personal and professional identity. So I would try to have it for myself first. How would I introduce myself to a new colleague professionally? I would introduce myself to a new colleague by telling that, of course, my name is Ardi Findiartini. I'm a medical educator from Indonesia. I'm also a researcher in medical education, and also I'm a physician. So whenever I see another group of people, not professionally, probably parents in my children's school, I would, of course, choose how I would present myself. I'm a mother of my daughter, for example, and etc. So it's more into the personal identity rather than professional identity. So I would like to ask probably one or two of you to share with the audience in this webinar. How would you introduce yourself to your colleagues professionally? Probably you can unmute yourself and tell us how would you introduce yourself. Can I start with you, Gominda?
Yeah, I was about to unmute myself. So probably the name comes first.
Yes.
I'm Gominda, and where I work will come professionally. Professionally, if it is a professional introduction, where I work, my institution, and in what field that I'm working. And perhaps some of the other things that I do and what the research that I do, I will stop at that. It will be very, very formal. But of course, if it is if not a professional introduction, then as you said, I will go for my personal details. Who am I, who are there in my family and so on.
Thank you, Gominda. Anyone want to join to share? Can we have one more volunteer? Okay, Dr. or Professor Rabab.
Yes, good morning. I'm Dr. Rabab Abdurraouf from Egypt. I'm a medical educationist, have a PhD degree. And I think I'm a cooperative one, committed for work, and I need to advance my leadership skills to lead my group.
Okay, so whenever you are asked to introduce yourself here, thank you very much for sharing that you have the aim that professionally you are the leader, you are a medical educationist, and you are also the leader of your group, and you also share your intentions, how you probably join any collegial or professional interaction. Thank you very much, Dr.
Thank you.
Okay, so what is professional identity? So of course, is how we can assume our roles in our current professional identity. You can try to list your professional identity. For example, as Dr. Rabab said, medical educationist, I'm also the leader of the group, blah, blah, blah. I'm the leader here and there and etc. I'm also a researcher. I'm also a teacher. I'm also we're still working as health practitioners, for example. How we define that involves understanding of ourselves in relations to others, especially professionally. And it requires dynamic narratives to integrate those roles. For example, in day-to-day basis, in the way we schedule our time, we might have some conflicts in how we manage our patient consultation time, or how we manage the way we or the allocating time for our medical students or residents or health professions, education students in our clinic, and etc. We always face that kind of conflicts in day-to-day basis. And the way we relate our professional identity to our roles will help us in, or at least will influence our decisions in how we prioritize our resources. And also, of course, it involves the personal, moral, and social factors. And yes, the core of this professional identity is the motivations. What is our aim? Why do we want to become medical educationists? Why do we want to become medical education researcher and scholar? What motivates us to become health professions education teachers? What motivates us to be medical students, health professions education students, etc. And at all times, we will negotiate with those identities. And at one time, probably we prioritize one or two identities. Okay, today I will allocate time to prove my or to take role on my identity on physician and medical or health professions education teacher. Tomorrow, I will allocate time. So how we prioritize that, and if we think that we are all three, we will try our best to negotiate between them. Okay, so why do they matter? In terms of how we develop the professional identity, which is actually really part of professional development of our medical students, or even us as medical educationists, who we are now, or medical or health professions education teachers, who we are now. We try to identify that at the beginning of our career path or our path as medical student or health profession education student, for example. And we're still in the peripheral space. We're still trying to search what to become. And we can see, you mentioned about the importance of socialization, some of you. Yes, it's very important because it allows social interactions. It allows how we can learn for our community of practice, how we can learn from our seniors who are first become the professionals in the field, so that we can have a clear description of who we become, so that we can fully participate to the roles. I hope this makes sense. So actually the professional identity formation is an inseparable part of professional development. We've been trying a lot to put our resources really in instilling the professional development in our curriculum. So I think it's also important for us to really understand what's the journey, so that we can support our students to be the professionals that we expect. Okay. Yes, socialization. Who we are, the existing personal identities, who we are individually, who we are in terms of the relation identity or collective identity, and we come into a melting pot, allowing for socializations. We see our role models, we have dialogue with our mentors, we have our reflections on who we are, how we can take meanings of our experience, whether it is done consciously or unconsciously, how we see our first patients, for example, how we see our first experience in facing deaths of the patients and family in our clinical learning experience, for example, everything. So the socializations is the melting pot where the health professionals, the health profession students come into one place, and the aim is to also give the opportunity, the best opportunity for the students to become the professionals. And it also applies for us as medical and health professions education teachers. Perhaps we are the health professionals. We think that we know how we teach, we know how to become best role models, for example. But by realizing that our existing personal identities, and when we declare that we are medical teachers or health professions education teachers, we need to also be aware of what are expected from us and how we can keep giving our best in terms of really executing our roles. So therefore, the personal and professional identities. So we will later discuss about the role of the curriculum, the role of the self-reflection capacity, and etc. So the melting pot, again here, for the students and teachers, regardless our field, is what's the role of medical and health profession schools? How the medical and health profession schools become the nurturing melting pot? How our teaching hospitals become nurturing melting pot? Can we always control everything? Can we, rather than control everything externally in terms of the environment, how can we best prepare our medical and health profession students to have a reflective capacity and also to take lessons learned from their environment, be it negative or positive? So as I mentioned, whenever we discuss about professional identity formation and personal identity formation, is actually the inseparable part of our understanding of what professionalism is. It consists of the virtue-based professionalism and behavior-based professionalism, and also the personal and professional identity formation. Because we don't want professionals in any field we're working who can only follow the rules, but they don't understand why they follow the rules. We want some professional who can adapt with all of these current disruptive situations, very chaotic situations, how they can still act professionally, but they can take the meanings of the actions to become better. So the disruption is here. We've been discussing a lot about this, the Industrial Revolution 4.0, 5.0, and etc. But currently in our phase, in our countries, we have this disruption catalyzed by COVID-19 pandemic. It really hits us in all aspects of our life. So whenever we talk about this, can we take the disruption as our opportunity to look back of what our roles are, be it medical practitioners, physicians, health professionals, medical teachers, health professions education teachers, or even medical students, health professions education students? How we see this as the catalyst. So just 2 days ago, this has been published, and I had the opportunity to share thoughts with Professor Squid on this. And I think I do believe with this message that I think we should never waste a good crisis. So this is our time to really see this pandemic as the catalyst. Of course, we need to survive this, but at the same time, we need to also see ourselves. We need to see our profession and how we can be resilient. And this highlight how we conceptualize knowledge then and now and in the future, how we manage our trust with our students, with the information around us, and how we see artificial intelligence, technology-enhanced learnings, machine learning, and how we consider good doctors and health professionals, good medical teachers and health professions education teachers, good students now and the future. I think it's really time for us to really act something to contribute to the current pandemic situation, to solve problems around us, of course. But at the same time, it's also our time to reflect on how this influence our professional identity because we do understand that the future is now. We probably have not too much control on the future, but I think if we see ourselves as professionals in any field, we need to always see what is the knowledge and cognition. We believe that metacognition is required. It's not always about the knowledge which can be accessed anywhere now, but how we can take meanings of that, our technical skills, as well as the human presence, our caring and compassion to our family, to our students, to our colleagues, to our environment and the community. Because the understanding of the professional identity formation and also awareness of the challenge of this pandemic and other disruptions makes us think about the importance of going back to the core. What will be the core of the competence? This can be applied for teachers, medical teachers, health professions education teachers, medical students, health profession education students, and the health professionals and medical professionals. Our capacity in using, developing, and interpreting data and make them useful for our decision-making processes, the use of technology, and how we explore ourselves and our community, understanding their culture and their specific social aspects, for example, how we innovate and design, how we communicate, and etc., becomes even more important. So I would like to share one of our studies in trying to explore the medical students' professional identity formation through written reflections during the COVID-19 pandemic. I would like to highlight that in literature, there are a lot of emphasis on the importance of looking back to ourselves and our reflections in supporting the personal and professional identity formation. In this study, we did the thematic analysis, and we can see that at the same time, students in preclinical and the clinical year try their best to adapt and to cope with the pandemic situation, with all of the change in the learning processes. They acknowledge the feeling, the risks and opportunities, and they have been trying to really adapt and contribute, participate in the shift. Whenever we move all of the preclinical sessions in our curriculum online, and whenever we needed to stop for a while, and currently we stop it again for our clinical rotations for our undergraduate medical students, but not for our postgraduate residents. Still, all of changes are happening have been happening at the same time, and the resilience really is the highlight. And at the same time, we ask students to also reflect on their perceived roles as medical students during this pandemic, their roles in serving the community, and also the professional dilemma in fulfilling the perceived roles. And there's also some attempts to quantify, even though we understand that this concept is very hard to quantify, on the professional identity formation of medical student. I would like to just take this is our adaptations on the questionnaire developed by a medical educationist in Japan. And from our validation process, we highlight that there are 4 aspects in understanding the professional identity formations, the journey of our medical students towards becoming the professionals. First is the recognition and internalization of professional roles, self-control in professional behaviors, reflections on the professional identity and professionalism, and thought processes as a medical and health professional. So further, we explored this, and we found that the students have been realizing the process of professional identity, how it started, the importance of motivation, what is the journey, how the values are processed, The factors affecting the professional identity formation in medical students consist of the internal factors, their values, their ability and traits, personal circumstances, and also external aspects such as the curriculum, the learning environment, and also the workplace-based learning. So it's now under review. Hopefully it's published soon. And going back to our attempt to understand the concepts of professional identity formations of medical and health professions education students, I would like to also highlight the importance of medical and health professions education teachers to also understand this as part of their professional development. Because as we know, we are expected to be the scholar, the expert, the researcher, the administrator, educator, leader at the same time. And by realizing and being aware of our professional identity, we hope that we can achieve excellence, embrace our identity, and we can try to give our best to fulfill that roles, including through the faculty development programs. The next era, or even current era now, medical and health professions education teachers need to be more creative, more adaptable to the current disruptive challenges. And we need to develop the new skill set in harnessing the technology appropriately and effectively. We need to involve students more. We need to even explore how the students learn and best practices to drive their learning practice behaviors, understanding the technology, caring, still compassionate and collaborative with our students, with our colleagues, and also develop communication skills using the interactive technologies. So this is our publications from this year. When we try to explore the professional identity formations of medical teachers in non-Western setting, even though the setting actually is only in Indonesia. But we can highlight a very important lessons learned from this study, that again, it's professional identity formation is a dynamic entity. It's a discourse, and it requires the interplay between our internal values and external factors. So we can see ourselves as medical teachers. We can see ourselves as health professions education teachers, for example. And it requires empowerment through early socializations. Whenever we feel that we are accepted by our environment, it supports our professional identity formation even more. And also the importance of experiential workplace learning, and how we see ourselves in the future, in the next 5 years, 10 years, 15 years, how we would see ourselves professionally. And of course, it will be influenced by how we see ourselves personally. So in our study, we highlight that in terms of the religious values, the family factors, and societal recognition is another additional factors that need to be considered whenever we would like to nurture and encourage the professional identity formations of medical teachers. And I think it applies to also in other health professionals education setting. So this is just come up, I think, yesterday. And I think it's very important to highlight that the question that I posed in these presentations, why the understanding of this professional identity formation even matter. We come to the life of social media whenever we need to identify what e-professionalism is, and it really relates on how we see ourselves, our students see themselves, how they see themselves professionally, what are their professional identities. So in these studies, I think you can access this online directly. It's open access in BMC Medical Education. And it highlights that the current literature on this particular topic highlight the very high usage of social media by healthcare professionals and students. And sometimes, even though we do realize the positive impact of social media on our medical professionalism, there are still some evidence, even a lot of evidence, that leads us to the awareness that not everyone has been aware of the negative impact of using the social media unprofessionally. And there is the blurring professional values, behaviors, and identity in the digital era. So again, whenever we have Facebook account, Instagram account, LinkedIn, for example, or Twitter, how we have been using it and how we connect that with our probably personal identity. We don't want to use it professionally, or we actually try to strengthen or try to use the social media to support our professional identity, for us to facilitate us in fulfilling our roles. And it means that we need to be aware of, really aware of the professional use of the social media. There's a very interesting study included in this review that highlights that the residents in one of the field in medicine who have been, who had found, who had unprofessional behaviors in using the social media, when it's not remediated well, they will come again. The unprofessional behaviors in using social media during their practice, whenever they are graduated, may take place again. So I think it highlights the importance of really pay attention to the professional identity formations of our medical students and health professions education students in this era, and being aware of the current challenges, not only the excessive information and really vast development in technology and also the knowledge, but also the really the strength, the powerful social media. And sadly, there is the limited evidence for teaching and assessing professionalism in the digital era. So I think with that, I would like to ask to really ask to reflect, what is it for us? Whether we are health practitioners, whether we are teachers or students or educators, I think the realizations of the disruption, the challenges in the current era, and including this pandemic, and also our awareness of how we try to define the future. I think from my personal reflections, I would say that our understanding of professional identity formation will bring us back to the importance of developing individually, of course, and as educators, the importance of developing the self and internal processes among our students, or if we are the faculty developers. So we need to also think about how we can include this in our faculty development programs. The reflective ability, the resilience and adaptability, how we can make people see and talk, discuss about their motivations and their journey, how we can actually provide the environment so people can seek feedback, safe psychological environment, and how people envisioning the future. And in terms of the external aspect and environments, we see that professional identity formation, it does not happen in isolation, of course. And it requires, for medical students, for medical teachers, health professions education students, and health professions education teachers, the nurturing curriculum, the supportive learning environment, the smart assessment, role modeling, mentoring, and supportive workplace-based learning and community of practice is necessary. So our understanding in professional identity formation will lead us to see our curriculum in a more meaningful way in terms of how we attempt to develop our colleagues, develop ourselves, develop our students to become professionals in the future. So that's for me. What's in it for you? So with that, I would like to ask your opinion or your comments. By understanding this concept of professional identity formation, what does it mean for you? With that, I would like to close my presentations. And I think before I can respond to probably questions in the chat, I would like to ask first this to you. Thank you very much.
Thank you very much, Arti. I think now we will expect populating this some at least some comments on this space, right? So yeah. After that, we will go for the proper discussion.
Oh, I think I can have it the other way around. So I will just stop sharing while waiting for people to really think about, because I think understanding professional identity formation and what it means for us probably needs some time, Gominda. So reflective ability. Thank you. So we can start to discuss the questions in the chat room.
Okay. So I think there are a few questions being posed. Let me start first, because I think this is crucial, which you sort of hinted on. Now, you said that the socialization is the melting pot, right? Now in COVID-19, in the crisis that we are going through, that socialization has been affected a lot.
Yes.
There is socialization, but it's more online. It's a different format. And the things that you said about the institute, the interpersonal relationships, all those are more or less cut off from this identity formation. So this question may be futuristic. This question you may not be able to answer immediately. I think that will be good. There will be good studies in the future as to during these 2-3 years, how was professional identity formation affected? But we don't have that yet. But let me jump the gun and let me ask you, how do you think that professional identity formation would have been affected by this crisis?
You always give me a hard question, Gominda, I know that. So thank you very much. I think you highlighted very important questions, and as you mentioned, I might not be able to answer that comprehensively, but let me try. I think in terms of the professional identity formation, since it's a very dynamic process, I would like to challenge us all in terms of how we would describe professionals in the future. So of course, in terms of the how we see ourselves as health practitioners, how we interact with patients and their families and the community, how we as teachers, we interact with our students and etc. I think this pandemic should give us a lot of time or a lot of things to think about in terms of how we would define professionals, teachers, or professional health practitioners in the future. That's first. And by that, I would like to also, if we think that probably we need to change the practice of how we treat our patients, or how we prevent diseases, or how we teach our students. I think that's also comes into mind. I think it's not impossible to think about that. And seeing what is happening now, we do realize that in terms of the literacies of the data, technology, and etc. I think what has been suffering is the human part. So the human part, the interactions, how we, the role modeling part and the dialogue. Some can be moved online. I think all of our online activities have been very intensive for the past year. And of course, it requires us to think about, is it enough? So I myself, I would say that it might not be enough, but it's how we survive. That's why in terms of providing the melting pot or the community of practice, we think that for example, the way we prioritize how we manage the teaching and learning processes in our medical school for our undergraduate medical students. Okay, for the preclinical year students, we can move everything online. So it has not been changing since last year. So full online everything. But when it comes to our clinical year students, we do realize that this professional development and professional identity formation really requires the direct interaction, not only with the patients, not only with the health problems, but also with the future professionals, their teachers, their seniors, other health professionals who have a lot of contributions in forming them as the professional. So I think what we can do now, it's really surviving, Gominda. And in the end, we need to still be aware of that maybe what we've been thinking as the best thing that we've been doing is not the best. Because we don't even know, or maybe we need to prepare that this pandemic really teach us in a hard way that what we think as our anticipations in all things, the technology and etc., actually probably not always help us, and we need to be still open-minded and ready for the next challenge. I think. Sorry, I think my answer will not be the best, because I know that I think this is also very challenging point on reflections for all of us.
Yeah, I think it's very helpful though. I mean, you can't have an exact answer because we are still undergoing the pandemic and we don't know the effects of it yet in terms of, especially in terms of professional identity formation. A connected question has been posted, that is, how do different settings affect professional identity formation? It's quite connected, but what this person is asking is, let's say, urban settings, big hospitals, small hospitals, rural hospitals, community settings. If a professional is in that sort of a setting for a long time, will that affect his or her identity, and how will it affect?
Yeah, thank you very much, Gominda. And I think it's a very important question as well. And by understanding the professional identity formations and the importance of the socialization process, I think we can try to think from at least 2 points. First is how we picture our graduates, what kind of roles they need to take, what kind of doctors or health professionals we expect them to be. Because in our curriculum, whenever we develop our curriculum, we consider our students' characteristics, and at the same time, we also we try to envision what the graduates will be. And if we think that our countries, of course, we also need to consider what settings we serve, what setting our graduates will serve. I think in a way, by considering that and by understanding the importance of the learning experience, the role modeling process, and the learning environment, and also further opportunities on reflecting on that, on the professional identity and professional development, I think it becomes very important to, by design, we also try to match our aim in our graduate profiles with how we manage the curriculum and how we allocate and send our students in which settings. So if we think that we would like to produce graduates who are capable and more experienced in dealing with health problems in urban area or in rural area, it means that when we state that, we need to look back to our curriculum and to what extent we've been really incorporating the opportunity for the students to really experience that, so that they become more professionals and their identity as such doctors or such nurses or such pharmacists are really supported in the end.
Thank you very much. So another question is about assessment. I think it's not about assessing professional identity formation, but the usual assessment that we have. Will that affect professional identity formation? And if so, how? And is there any evidence for that?
Yeah, another critical question, because we know and all of us understand that students learn what we inspect, not we expect. So I think in terms of the assessment of professional attributes, professional behaviors, we need to still try our best to really incorporate that in our curriculum and make it more explicit. But in terms of the professional identity formation, I think I would like to recommend that we need to do more, that how the students internalize the professional behaviors assessment results and etc. So we can explore why they think, why they behave the way they behave, and why do we think that it's important for them now and for them in the future. So I think in terms of that, the dialogue, the mentoring will be very important to help students to really taking meanings from the experience they have and even the assessments they have. And of course, the first step will be make it explicit, because by making that explicit, it means that we have a lot of opportunities to really incorporate the reflection, the dialogue between students and mentors and the teachers, and help the students to form the identity, the professional identity more. So I think professional behaviors assessment is one thing, and making that more meaningful is further steps that requires more dialogue of the students and the teachers. And on the other side, it's also the importance of really being aware of the unprofessional behaviors at the same time. So whenever we think about the professional identity formation, and there are a lot of literature evidence for the past 3 years on the unprofessional behaviors and how we need to remediate that in the medical schools also comes into place and needs to be considered, I think. And whenever we understand the importance of professional identity formation, the way we see the unprofessional behaviors and how we remediate that hopefully become more meaningful for the students. So not only giving them sanctions or punishments, but also having them realize why such behaviors are unacceptable, for example. And sometimes these students having troubles in reflecting their behaviors, or they don't have enough metacognitive skills, or they even game the regulation, etc., because they just want to survive and I just follow the rules and I don't care about the rules actually, and I don't know why the rules are existing, and etc. So I think it's even more important in the melting pot is the core is, I think, the mentoring and the role modeling process. Gominda.
Thank you very much. I am mindful of the time, but in the interest of time, I think I will pose this last question, and we'll have to unfortunately stop the discussion. But this question asks, where should we begin first? The professional identity formation of teacher or student? Can we do both at the same phase or at the same time, probably?
Very good question. And I need to sometimes to really think about that. And let me think aloud. Hopefully you don't mind.
Yeah, sure.
I think it needs to be concomitantly processed because whenever we develop our curriculum, we do understand that there will be students there and there will be also teachers there. So concomitantly processed, but we need to think about what the professional development of our students first, probably. And then by thinking about that, we start to think about what kind of teachers we need. So we explore the professional identity of the teachers so that we can support them in any forms of faculty development in our institution. So I think realizing first, so I changed my mind, sorry. So I think by realizing first the professional identity formation, professional development, the importance of the students to really aware of their personal identity and really aware of what they become, what they are at, and what they need, it's important. And by that, it means that practically we require or we expect to have teachers who are open-minded, who really know their role as medical teachers, who really can relate to their medical teacher identity or health professions education teacher identity, so that they don't mind giving time to listen to the students and discuss with the students in the small group, for example, on that they're confused of something or their dilemma, etc. in the mentoring sessions, for example. So I would say we go back to our curriculum, we go back to our visions, what kind of graduates we are going to produce, and being aware of our students and their developments, and then we can move on from there to support the teachers. Thank you.
Thank you very much, Adi, for tolerating all those questions. That's so much from me, but before we end, I will hand over the session to the conference secretary, our conference secretary, Dr. Rizka Ishan, to do the formal vote of thanks. Over to you, Rizka.
Yes, thank you, sir, and a very good afternoon to all of you. On behalf of the College of Medical Educationists and the organizing committee of the Colombo Conference on Medical Education 2021, I would like to express my gratitude to Professor Adi for her volunteer participation and sharing her expertise on a timely topic through a very engaging session. Thank you very much, Madam. And I would also want to take this opportunity to thank our great team that works behind the scenes tirelessly to bring all of this together. Dr. Pandula, Dr. Charmika, Dr. Vasuna, the coordinator of today's event, and of course our moderator for today's session, Professor Gominda Punnaparuma. So with this, we conclude the second pre-conference international webinar of the CCME 2021. We invite all of you to our next pre-conference webinar scheduled on the 25th of August, Wellbeing Matters in Health Sciences Education, yet another timely topic. We hope to see all of you at the main conference in November. Thank you and have a good day.
Thank you very much, everyone.